centralize the tape
Okay.
like right here, so we can hear the entire room.
That's a good suggestion. Would you mind putting it on the executive? Good morning, everybody. My name is James Campagnazzi. I'm the chair of the task force. Why don't we start with introductions? On my right is
Shanita Gardner. I'm a resident service coordinator for Mission Housing Development Corporation.
okay. Down there at the end.
I'm Randall Sloan.
Now, what group are you with?
I
Are
come
you
from...
representing tenants?
Yes, tenant
Okay.
representative.
Oh, thank you.
Good morning, Clifford Gilmore, Central City SRO Collaborative.
Good morning, Dion Roberts. I work for Mary Elizabeth Inn, and I'm sitting on seat number 4, nonprofit SRO operator.
All right, thank
Good
you.
morning, Raul Fernandez Berriosala with the SRO Families United Collaborative.
Peter Keefe, Deputy City Attorney, Legal Advisor.
Adaka Uday, Health Department, Senior Environmental Health Inspector.
Sam Patel, SRO owner.
Margo Antonetti as a representative for the Department of Homelessness and Urban Housing.
Jordan Davis, tenant rep, she, her pronouns.
Okay.
Bernadette Perez, Department of Building Inspection, Housing Inspection Services.
Trina Gomez, Department of Building Inspection, Housing Inspection Services.
All right, thanks, everybody. Next item is approval of the minutes from January. The March minutes. Change the agenda. Does everybody have the March minutes? Yeah.
Just on the last page, it's Michael Penner,
Okay.
and he was not speaking for the Department of Homelessness and Supportive Housing, and he made that clear.
Okay. So we will amend that.
Yeah, but it's Penner EL, just add that.
Penner. P-E-N.
P-E-N-N-E-L. It's just an E-L at the end.
Okay.
Thank you.
Sure. Okay, anything else? Okay, is there a motion to approve the minutes? Margo Antonetti, second.
My second.
Clifford Gilmore. All those in favor? Objections? Okay. We have a new person joining us. Angela, could you introduce yourself?
What?
Could you introduce yourself, please?
Huh? Introduce yourself.
Oh, sorry. I'm Angela Chu. I'm with the Chinatown SRO Collaborative.
Thank you. So, I think most people were aware that we were renewing the terms of the membership. There was a lively debate at the board, and we want to welcome everybody here, and congratulations everybody for having your term either appointment or renewed. Let's give ourselves a round of applause.
And I just
Yep.
want to say, I don't want to elaborate, but let's put what happened at Rules Committee behind us. It's a new day, and I hope we can all work together.
You're here, I second that. Thank you.
Now you're making me curious, but okay.
I really appreciate that sentiment, Jordan. Thank you. And I will certainly try to do that, and I hope everybody else here will. All right, great. Are there any other comments on item 5?
Can we just welcome the new members and have them introduce themselves once more so they'll get the names right on the...
Okay. Shanita, could you start, please?
My name is, I'm sorry.
Yeah, would you just say, I was just trying to
My
update.
name is Shanita Gardner. I'm a resident service coordinator for Mission Housing.
Okay, thank you.
And Shanita also has experience with Caritas Management, which is a
Yes.
for-profit property manager.
Right. You work with them, right? So, yeah.
Yeah. And what SROs have you, or you most familiar with? Which building?
The Apollo Hotel, Altamont Hotel, South Park.
You know, those two buildings, the Apollo and the Altamont, does everybody know where they are? One's on Valencia, one's on 16th Street. I was in the, way back when I was working with the tenants very closely at those two buildings when they were privately owned buildings. I helped some of the people there form tenant councils. And because they had active tenants councils there, that led to the sale and development of those two properties by Mission Housing. It was a long time ago. I think, was Rainbow or Charlie, do they have those?
That's my dad. The Apollo was mine. It was
oh,
ours. We were involved.
Yes, so you remember it well. So that just goes, speaks to the partnership that we have going way back, right? Okay, and then Dion, you're new.
I'm new.
You're already on.
Yes, my name is Dion Roberts, and I'm the Executive Director of Mary Elizabeth Inn. Mary Elizabeth Inn is a nonprofit organization that's been in San Francisco for more than 100 years, and we administer housing programs for formerly homeless women, low income. Many are survivors of domestic violence. We administer our programs in 2 SROs in San Francisco, and we are, I think, among the community of SROs, we're the only single gender SRO that actually has on-site comprehensive services and, you know, free meals and things like that. Yeah.
I met a couple of your colleagues at City Hall last week. Kathy Black is one of
Kathy
them.
Black.
Is she on your on-site staff?
Kathy Black is the Executive Director of La Casa de las Madres,
Right,
and we
okay.
partner with them for the provision of supportive services. So yes, our service delivery mechanism is, you know, we do have on-site case managers in each building.
But you're part of a network that includes La Casa de las Madres. Would you say that?
They're our service partner.
And are there other groups that you're partnership with also?
Well, for funding purposes, it just so happens that in addition to receiving funding from HSH for our programs, we also, since 1996, we've been receiving funding from the Department on the Status of Women to provide housing for women who are exiting DV shelters.
Some of us here have also worked with some of those shelters or support networks, and it's you know, it's a good network of groups, and I'm glad you guys are part of our community with the task force here.
Thank you.
And Randall?
Yeah,
You
Randall.
go by Randall or RJ?
You can call me RJ.
Okay.
Most people call me RJ. Randall Sloan or RJ. I am a new tenant representative, and I'm honored to be here. I live in a supportive housing environment in an Episcopal Community Services building in Soma. So I'm not sure what information you guys would like to hear.
How large is the building? How many people live there?
About 120 tenants.
Wow. And how long have you been active with tenant issues?
About 4 years. I've been advocating for tenants with, in association with Central City SRO Collaborative.
Okay, and
I
what
do
is
some outreach at private SROs.
And in what parts of in Central City, probably, right?
In the Tenderloin and Soma.
What about the 6th Street area?
We're good there.
Okay. Sure you meet a lot of interesting folks?
Yeah.
Yeah.
I do.
All right, well, welcome to all our new members.
Welcome.
Now, why don't we move to the next item? And that is SRO rent subsidy. Now, one of the members, Jordan, proposed a resolution, and we were able to distribute that to everybody. Did everybody get that? Okay. I'm going to ask Jordan to introduce the topic, and then we'll open up to comments.
Well, first off, for the new members, you're all in luck because you'll be getting to make a decision on something, but this is an issue that is near and dear in my heart, and Margot over here from the Department of HSH, sorry, actually has some friendly amendments which I'm willing to accept. Basically, the issue here is that there's a lot of, we have a really big budget in the city. We've gotten a lot of things like done. We're like, and basically like a lot of people in the support of housing are basically paying 50% or more of their income towards rent, and it's very uneven. And some supportive housing sites you're paying 30%, and what I'm asking for is more rental subsidies, so that way we only pay 30% of our income towards rent. We can definitely afford this, and I don't want to create competition with anyone. I don't want to create competition with any social or economic justice issue, and I don't want to like create any. This is a win-win-win-win-win for everybody involved, and I feel that this is something that that we can get behind. And I've had a lot of lively conversations, but I feel like that this is the right thing to do, and when and I don't want to create any burdens on nonprofits. I don't want to create any burdens on owners. I don't want to create any burdens on the collaboratives. And feel free to vote your conscience on this. And I know Margot over here has some friendly amendments. So yeah.
Is that a good time to do it? Okay. And this is if this resolution passes here, then it goes to the Board of Supervisors?
It's just,
is that what is the plan?
Okay, well, in this resolution, it asks us to send a copy to the Board of Supervisors.
Okay.
There's no requirement that the Board of Supervisors, what they do with it, whether they read it or do, I don't know what they're going to do with it, but I'm sure Jordan will be helping them.
I mean, I would just say, just from a legal standpoint, what this body does is essentially, it's a recommendation, it's advisory, it's sort of, it would be stating that it's the policy of this body or the recommendation of this body to take this step. It doesn't have any, it doesn't trigger any requirement for the board to act. It doesn't have legal force itself, but again, the purpose of this organization is to state positions on issues that are relevant to SROs generally.
Thank you. Before we get into other comments, I want Margot to finish her.
I just have one more question. So is it a resolution or is it a recommendation? I think
Well,
people just need to know that.
It's a resolution, but it's a resolution of this body.
Yeah.
So, you know, because the board can pass a resolution, but it's, this is our resolution.
Great, yeah, because we are a body of recommendation. So, I don't know, did everybody have time to read this? Should we go? Okay. So I have a couple of friendly amendments. The second paragraph, it says U.S. Department of Housing and Urban Development defines cost burden as paying more than 30% of one's income towards rent, and those public and subsidized housing generally sets rents at no more than 30% of one's income. I think we need to say, and those HUD subsidized housing generally sets rents at that amount, because it is actually otherwise not, as you were actually pointing out, not necessarily across the board.
Let me just clarify.
Yeah.
So we're going to take out the word public and
put HUD
and
instead.
put HUD.
HUD subsidized housing, yeah.
Okay.
And then the next one, whereas many tenants in nonprofit hotels, I think it needs to be said nonprofit managed hotels. And the same is in the next paragraph, it should say nonprofit managed hotels. And I mean, I don't know if you're going to agree on this, but pay 50% of the income or more of the income toward rents. In general, our contractors, unless it's capped, none of our contractors should be asking for more than 50% in rent. And if that is the case, and we've already started to follow up on that, then that is a mistake. So, however, cap, if you want to look at it, people do pay more than 50% of their income in rent because it's a legislation and it's totally separate. So I just wanted to put that out. I don't know what we want to do around that, but in terms of hotels that are not capped, there should not be a rent that's higher than 50% ever. And if there is, then
You're
we
saying
need
like
to.
if the people aren't receiving the cap benefit?
Yeah, it should not be more than 50%. And if there is, then that is something that we need to follow up on. That's yeah.
I was going to say, and forgive me, my first time here, I don't want to be out of order, but I understand we're in the process of, this is open to discussion, so I do have questions myself, and you touched on some of them, Margot. I'm curious as to what is meant by a nonprofit hotel. I think as Margot was trying to clarify, there are nonprofit organizations like Mary Elizabeth Inn. We administer programs at 2 hotels that we are master leasing. The Verona is owned by for-profit individuals, and the Mary Elizabeth Inn just happens to be owned by a religious-based nonprofit organization. So, so I think that needs to be clarified, that I don't know that there are nonprofit hotels, except for what I just mentioned, the Mary Elizabeth Inn, and we're the ones administering and master leasing that. And then, I can certainly agree in terms of the individuals that are referred to our housing programs. There are 2 types of capped income. It's around $500 a month or $700 a month, and the city has already determined, based on this legislation back in 2009 when the Care Not Cash program was implemented, the plan was you get your cap, take a portion of that to pay for housing, and the balance is what you live off of. So for instance, right now for our residents, they're either paying $278 or $317. And for the person that's only getting $700 a month and paying $317, it is definitely more than, the 30% of their income. But that's also what is being dictated in our contract. And that's because the contract or the grant pays for what it costs to maintain the building, less what we receive in tenant portion of rent. So if we start getting less tenant portion rent, then the city has to make up the difference to pay for what it costs. And then I guess, as you were saying too, Margot, there are some SROs that are not contracting with the city, for services and what have you, so they have their own flat rates. And then there's those of us that are contracting with the city, and the city dictates what the tenant portion of rent is.
So, these 2 sentences, we could have a lot of discussion about. They bring up a lot of issues, but if it says many tenants. So it doesn't say all the tenants in certain hotels. And the way Jordan wrote that, I think, is actually pretty good, because it's not making a blanket statement for everyone or every kind of hotel or this kind of hotel or that kind of hotel. It just says many. So
Let's leave that. I'm fine with leaving that.
yeah,
As
I'm
long as we
okay
put
with
the
it.
non-profit managed hotels, Do you want me to?
Yeah, please continue.
And-
Can we
and
move
then-
on to the
okay.
next? Yeah.
So the next paragraph, I would suggest that we take out, because that is actually speculation and not necessarily true.
Which one is that?
Whereas many master leased hotels charge flat rent. And then the next one after that, which talks about the consequences of this rent burden, I would just say that we should take out the part that's in parentheses, paying for food, especially those with special dietary needs. I think it actually takes away from the fact that this is an issue for anybody who's trying to eat. And then it says closing phone bills, etc., and it takes a toll on their physical and mental health. Again, I think we should say may take, because otherwise it's speculation. And then be it resolved is fine, and then be it further resolved, and it's just another time which should say non-profit managed hotels. And those are my friendly amendments, which people can agree or not agree
Okay.
with.
More comments on those?
Is there a reason why it only would say non-profit managed? I mean, what about for-profit managed SROs? Could they not have the same?
Jordan, what's your thinking?
Well, for one thing, I'm willing to accept the amendments, but the issue here is nonprofit is often used as in the sort of like SRO spaces to talk about like those hotels that are either managed or owned and managed by nonprofit organizations and under the jurisdiction of HSH. Now, for-profit hotels are another thing entirely. They're basically like, there's two ways we could do this. One is the recently passed Community Opportunity to Purchase Act, which includes SROs. It's basically like allows nonprofits, and it would create another category altogether to purchase like a fair shake at purchasing private properties which are being sold. It was recently passed out. It was Supervisor Feuer's legislation. And another thing is like the issues around rent control, which of course like would have to be addressed at the state level because of Costa-Hawkins.
So those are all excellent points, and I think what Jordan has done here is starting off with a certain segment of the population, and if you bring in all the for-profit hotels, that's another big segment of people that are harder to reach, harder to kind of presents a whole different set of issues. It would also probably make it harder to, when you start off with a smaller grouping and make it easy, there'd be fewer people that would be opposed to it. What a lot of people, that's what I would think.
If I may, I think
Yeah.
I'm just kind of getting thrown off by the word nonprofit. That's what it is. But what I think, are we talking about all of those SROs that are master leased through HSH?
Yeah,
Basically.
Is that?
that's what we're talking about.
We're
right?
talking about like HSH master lease, but also like any hotel which is under the jurisdiction. It could be like something that's where the owner or the nonprofit actually owns the hotel, or something and owns and manages, or like just manages, which is like with the master lease.
So HSH sponsored master leased SROs.
Yeah.
Funded.
Or funded, yeah, HSH.
You want to say funded instead of managed?
I don't
Yeah, funded.
don't care. It just, I think it just has to be clear that, you know, it's not the master leaser of the hotel that sets arbitrary rents.
Well, it actually, if you could say the word managed, if it's owned, it's also managed. So they
Right,
cover
so,
both.
yeah, I mean, if people agree to it, I think there are very few SRO hotels that are actually owned by, well, actually, I don't know that that is true.
If a nonprofit
Yeah.
owns the building,
They still
they're
manage.
also
yeah,
managing the
yeah,
building.
Yeah, yeah.
So it covers
That's
both.
up to.
That's not always the
Not
case, though.
really?
Yeah, there's a lot,
That's
there's a
a good
lot of
point.
nonprofit organizations. Well, think of one of the biggest ones in the city, Tenderloin Housing Clinic.
Exactly.
You know, they master lease, 15 or 16 SROs. All the SROs are owned by private individuals.
But they're
But that's
managed.
okay, they're managed
They're
by a
managed.
nonprofit, and they're an HSH contract,
Right.
you know, so. And, because that's where we would be able to really exercise oversight, right? If we focus on the HSH funded,
Okay.
master leased SROs.
Any objection to that language?
So, sorry, would you like to speak?
Well, I don't have objections to the language. I just want to clarify that this body doesn't oversee master lease managed, CBO managed SROs. It's we are here as a body of the mayor and the board, and we give recommendations. So we don't oversee. I wish we would. We also don't oversee the private hotels. What we can do is we can write a resolution like that and give recommendations.
Okay, other comments?
I feel like,
Just a technicality.
like, so I'm guessing, like, would there be interest in replacing nonprofit managed with all the references, 3 references here with HSH funded and contracted? Or would that sound good? Would that like HSH funded or contracted and
HSH funded.
All right, yeah.
I have one concern about it.
Right, Sam
Sorry,
first.
go ahead.
Oh, go ahead.
Sorry. No, you go ahead.
That's gonna create issues because some for-profit operators have tenants that they work with, like THC and stuff,
Yeah.
who are funded through HSA or SHH, whatever. So no, that's not going to work, because I'm totally against this whole resolution as it is. It might create some kind of a discrimination throughout the whole population of the SRO as a whole. I'm not sure, maybe Larry could look into that. Second of all, for-profit is for-profit, and the market sets the rates for everybody in those SROs, and the rent board controls our rates and everything for the profits. So, I think we need to definitely, before we do any kind of resolution or anything on this thing, to kind of really look into this.
Any other comments? Cliff?
Clifford Gilmore for the record. I actually want to begin by saying that, Jordan, I appreciate you bringing this before this body in the spirit in which you have done so. And I also appreciate your statement at the last meeting that you use yourself as an example, as a proponent of this, and basically said that, there are necessities that you could actually benefit from with this reduction in rent. You said, I for one do not use drugs. And I think there are a number of tenants like you that, have that kind of discipline. However, on the flip side of that, if we look at things in its totality, and I'm using really THC as an example, who has some 1,500 tenants, there's a substantial number of tenants who do not have money management skills. There's also a number of tenants, and this is according to someone who has been in our housing department ever since THC came into existence. So this person's been there 35 years, just dealing with this issue of tenants and leases, evictions, pay and stay agreements, repayment plans, all that stuff. So in terms of one question that this raised is whether or not what's going to happen if this actually happens. And in fact, there are tenants who have repayment plans agreements that in some cases they've defaulted on, and that they owe substantial money that currently they're not able to meet that obligation. Would the city, in fact, find a way to help clear that debt, or not? That's just one question that was raised.
Okay, so let me just ask a couple questions directly to Jordan to see if we can clarify some of these things here. Jordan, are the landlords that collect these rents, are they going to get any less money if this were to be happening?
No, because we're asking for more subsidies from the city, so the landlords would still get the same amount of money. I wouldn't. It's not about it's not about putting cost burdens on landlords.
Rents
or-
don't go down.
Rents,
Is that
so rents would go down for the tenant, but like because there's like more subsidies, then like they're getting the same exact amount. So I crafted this to make it like so that way the landlords get the same amount of money.
Yeah,
What do you say to that, Sam?
I disagree, because a lot of these leases are coming up within the next 3 to 5 years, actually, starting this year,
Yeah.
they're coming up. And if the city operating budget is gonna be that much higher with lower rents coming in from the tenants, they're gonna say, they're gonna offer the landlords a lot less money, and the landlords are gonna say, well, we can't afford to do that. And it's gonna create where they say, well, just give us back our hotels, and you're gonna lose housing stock, actually.
How does it lower the amount of money the landlord that comes into the landlord?
Well, the rent, the new rent negotiations are gonna be, the city's gonna say, well, we can't afford to pay you what the market is right now in leasing, and they'll say, well, the landlord has the right to say, okay, well, we'll take the hotel back.
Yes, health department, sorry.
I believe Jordan mentioned that the money should be coming from the city, and that's where the shortfall will play in. So both parties should get the same amount. It's just the city's gonna pick up the tab. But you're saying with negotiations, the city is gonna say, we don't have that extra money. I think that there should be a funding source. I'm not sure if it's gonna come from a general fund or of a revenue fund. But so far the grants, there's a lot of grant money right now, and from a lot of companies. But if that money runs out, where do you expect the money to come from for the subsidies?
Raul, do you have a comment? Okay, Margo?
yeah, so this resolution, and again, I'm a city employee, I don't get to speak for or against the resolution. I'm just, my interpretation of it, and I think that's a good thing, is that this resolution actually doesn't talk about implementation, and it doesn't talk about funding. Now, that doesn't mean that shouldn't be discussion, or that doesn't, that people might vote against it, but I don't think we can take it for granted that the city has that money. The money may very well have to come from somewhere else, but implementation and budget is kind of it's not actually involved in a resolution. You're not saying in here how it should be implemented, and I think that's actually a good thing. That doesn't mean, it's a recommendation to do this, but it doesn't say take this money away from that and pay for this. I think that's a budgetary issue that, I think it's a good thing not to have that in the resolution, because then I don't think we would ever pass it, anything, because there'd be too many variables to it. So.
Jordan?
Like, I would not, look, what I'm trying to do here is just create a win-win-win, and if there's, I wouldn't go forward if like any owner or any nonprofit would have a hardship. This is all of us asking for the city for more. We gotta ask we got a pretty large budget right now, and we might even get a lot more. And well, this thing is not resolutions are not really about implementation. It's about recommendation, and people like the Board of Supervisors for their budgetary process are gonna have to eventually figure that out. I mean, it's not really a from this body standpoint. There's a lot more this is just passing it out and just figuring out. And I'm hoping that yes, even landlords and nonprofits would be at the table once this. If we pass this out, I want them to be at the table. I want everyone to be at the table.
Margo, I have a question for you. How does Section 8 work? That when somebody has Section 8 and they have a rent, let's say their rent is $800 under Section 8, how much does the tenant pay and how much does the United States pay?
But Section 8 is always, the tenant portion is always 30%,
Right.
and it's a HUD program,
Right.
and so and that's why I asked to substitute HUD in the second paragraph, because it is something that HUD says. I think we can all agree that that is reasonable, thing, it's just not everything is funded by HUD.
So
Either
if
peop-
the rent is subsidized,
Yeah.
does that mean the rent has gone down?
No,
No, no.
It means the
no,
rent is the same.
the owner.
Yeah, yeah,
It's
the
the money
subsidy
comes
pays
from
the
different
same.
sources.
Yeah.
The subsidy pays the same, so I think what Jordan is asking for is actually not necessarily more subsidies, even so that would be great as well, but to increase the subsidy, right? So
Yeah.
that the tenant portion goes down.
And,
It sounds a little similar to Section 8 to me.
mhm.
Well, I think, in HUD-funded SROs, it is 30%.
Right. So all
But
those,
Section 8 is just a different subsidy, the subsidies for the master lease hotels. Some of them come from HUD, most of them come from the
so there's a
city.
block in the Tenderloin all the way around on Eddy, Taylor. You know that block where there's all like the manors? They were part of that huge lawsuit against the Hilton when the Hilton moved into the Tenderloin, and it created 6 or 8 SROs that were going to be HUD subsidized forever or something like that.
But those are nonprofit built, developed
Right.
and owned, like Light has 3 of them
And those
actually.
people pay 30%, and it's subsidized by HUD, the balance of their.
I don't know
So-
what they're, not all of them are funded by HUD. I know some of them have, but I can't speak to that.
I was just gonna say, maybe to simplify it a little bit, if I own a building, whether I'm a for-profit or a nonprofit housing developer, if I own a building, I'm charging my tenants, say, $1,000 a month. That is what the rent is.
Right.
But then if they have a subsidy, there's a tenant portion, and the tenant portion will never be more than, $300. So that's what the tenant's out of pocket is. But the landlord, the owner, I'm still gonna get $1,000 a month for that unit. So yeah, the SRO kind of mirrors that HUD methodology, if you will.
That's how I see this, but it doesn't say
But-
where the money comes from
Right.
and how much it's going to cost.
But if I may, I just want to speak to Sam's point, because Mary Elizabeth Inn is currently in the process of, renegotiating our lease for the Hotel Verona. And so if, let's just say hypothetically, right now, the residents of the Hotel Verona pay 30% of their income, no more than 30% of their income. So when I go to the city and I present them with this lease that they have to approve, if I suddenly decide that, I'm gonna start collecting less, I'm just using this as an example, if I'm gonna start collecting less than 30%, then that's less rent revenue that I'm gonna have to go towards what it costs to manage the building. And then my landlord wants, $40,000 a month for their building, let's just say. So, and that could be an increase, in what they're currently getting. So what I'm saying is, the owners of the building, they receive leasing cost. And then we report that to the city. And so if we're getting less money from the tenants, then that's more money the city is gonna have to pay. And I think we all get that. We all get that, right? If the tenant portion is less, then the city, who's funding the grant, has to pay more. That's all. And what Sam is saying is, the city might, when the landlords go to ask for their rent, the city might say, well, this budget is costing us so much because we're collecting less tenant portion. I don't think we can give you the increase you're seeking,
If I may just add to what Dion is saying, is the part of the thing is, the city can afford bigger hotels where, the cost to operate them are a little bit, a lot less than smaller hotels. So, for example, like the Verona is 70 units, but there are buildings in the program that are less than that. They're in the 50 unit range. It's costing the city a lot more to operate those properties as it is. But there aren't any more bigger properties in the city to master lease anymore. So if the city can't afford to pay, and unfortunately I'm talking on behalf of the city at this time, if the city doesn't have the funding to bring these, master lease these buildings when they do come in for a renewal, because of the cost to operate is gonna be so much more expensive, they're gonna come back and say, well, we can't manage these buildings and, or we just cannot lease these buildings anymore.
How many years are a typical lease?
They last from anywhere from 10 to 20 years, but they are renewed on a yearly basis. So the city could, if the cost is so much for them, they can just say, to give us 6 months to say, we can't lease this building anymore.
Well, the city budget goes in a cycle, and sometimes it's really good, and sometimes it's not good. So that's going to impact it.
Well, it's impact, and the general funds, most of the money is, out of the dollar, 90 some odd cents are already taken into account. So there is no general funds that are going to be available for these kind of housing issues.
Other comments? Well, it's a very interesting discussion.
Just my
yeah.
last thought on this is, I'm just asking the city to step up its funding and step up its game, and I'm not asking for any hardship. And I made really certain in this resolution, in the last line, that in furthering rent relief for tenants in nonprofit managed hotels, no extra cost burden should be placed on hotel owners, operators, or nonprofit housing providers, nor should, in allocating these funds, compete with any budget ask that advances social and economic justice. So what I'm trying to do is let's pass this, ask for the money, and I know it won't be an immediate process, but we need to get the process rolling, and we need to start this discussion in earnest, and to take this issue very seriously, because let's face it, I deal with a lot of hunger issues, and I deal with a lot of stress from living in my nonprofit SRO, and frankly my mental health is deteriorated, and let's just say I didn't eat for a week last week, and I've even thought of doing things that I'm not going to repeat here.
Well, do people feel like they have enough information right now?
I think we're still in discussion, right?
Yep.
So I just wanted to touch upon something else so in terms of unintended consequences, I think that's one of the realities of moving in this direction, not saying that it's necessarily a good or bad thing, but maybe it might be a factor. And that is that, particularly in talking with our tenant leaders, they feel that people in their building, particularly in your building, Jordan, the Heartland, that they don't have faith in tenants in the Heartland being able to make good choice if they were able to get this windfall. And so I think that is something that is coming from tenants. And so to that, I think we could consider, if we decide on this recommendation or resolution, that the city be asked to provide some sort of budget workshop, financial training things for people in terms of being able to be better stewards if in fact they're getting additional money.
Okay, so before I let you respond to that one, I want to bring up 2 points. And the first point is that I acknowledge the issue that Cliff is raising, but it's kind of a loaded argument, because you're sort of, although there are varying levels of competence out there, you're kind of denigrating people a little bit when you go down that road.
Well, what I'm saying is that this is coming really from...
no matter where it's coming from.
Okay, no, absolutely, I understand that. I definitely understand that. But I'm just saying that we want to make sure that, at least in my opinion, we want to make sure that tenants are doing everything they can to protect themselves. Okay. That's really the point here.
Okay. But my other point is that I could use a little more information, because I have no idea how much this is gonna cost, and saying that it's not gonna change any burdens, and it's not gonna compete with any other social justice ask. I need to know how much money we're talking about, or else I don't know if that's even possible, because there's lots of people out there that want funding for all kinds of good things. So I'm kind of leaning towards I might need a little more information. Are there any other comments? Jordan, is there anything you want? Oh, there's one comment.
I just wonder what would be the average intake for a tenant if they did only pay 30% of their income? How much would they actually retain?
Basically the difference between the, right now in the Heartland, you're paying 500. Now, SSI would range from, based on like 30% of SSI would range from 279 to 304, which would be between roughly 196 to 221. And to Cliff's point about money management, yes, I would support that. Yes, I would definitely, like, within 100% support money management training. I would support budgeting. I would support everything that you said right there. And but I didn't really think that would be necessarily something for this resolution. And I just want the city to explore this. I just want the city to explore this. I just want to move in that direction. I don't know what's gonna take. And I even and I even ran a calculation based on 221 for and based on it'd be like 8 million extra 8 million per year for and that's counting the master lease properties, and that's a really highball number. That would be an extra in addition to whatever's being spent right now.
Okay, other comments? Yeah.
Just to say, I love the spirit of this, really. As I gave an example, I talked about the Verona, but at Mary Elizabeth Inn, there's about 58 units that are, occupied with individuals who are collecting general assistance. And so, what the contract dictates, going back to the legislation from 2009, is those individuals that get general assistance, they pay a predetermined amount. And so as I gave the example, someone who gets a $700 check every month, their rent is $317, So the question is legislation going to allow that person to only pay 30%, so $210 or whatever. And then if that's the case, then again, the city would have to make up the difference. So I love the spirit of it, but I'm the wording just kind of throws me off in some areas, and I think we need to do some clarification on the wording, and then definitely I think we need to get a better financial understanding of what it is that we're asking the city, the extra amount that we're asking the city.
We're just throwing out a figure here, and if there's a way that could be broken out in a visual of there was a diagram or something that I could look at that showed us, it would help my understanding. It would help me get my support for knowing really what this figure, where it comes from and how it's broken out. Other comments?
So last comment, quickly. So obviously the cost is a big issue. What's the estimated cost would be to the city? I think also that what happens if we're in a down economy? I think that's a question. My understanding in terms of talking with some people, that if the city actually decides to honor this, even in a down economy, they would still, do the subsidy, which would be a good thing.
Okay. Other comments, discussion? Angela?
I think it's a good thing to do to look at how the city is operating its housing programs, including the contracts with HSH. Is that in that what type of housing we are providing for people. I think that's the main question arise out of this resolution. I think it's a good thing that the city will look at ways to maintain good housing for people, especially under the programs. I think the resolution will actually ask the city to look at ways to improve what's being offered to people under the HSS department. I think there must be a way that the city would say, this is what we want to do with our money. This is what makes sense to provide housing for the population. I have heard a lot about the Care Not Catch program. And I think at least we should ask the city to look at ways to serve the people in the program. And this is one proposal to make the program better. I have hope that the city would really look at it and consider it. That's my
Okay.
thing. I just want to say I love that. I think that's not a bad idea maybe, is if we actually go back to the original legislation which dictated how much money comes out of a person's cap proceeds for rent. That's not, start there, maybe.
Okay. Other comments? Yeah.
Yeah, just want to point out that I'm a big opponent of Care Not Cash, although it was started with good intentions. Sometimes the road to hell is paved with good intentions, and it's just like we need to make sure there's care and cash, not care, not cash. And we really need to evaluate that, reevaluate that, because Care Not Cash was based in a lot of how it got support was a lot of stereotypes about poor people, and it was based in a lot of negative things that really hurt my feelings, and very much so, and hurt me so much that I did not vote for Gavin Newsom.
So let's try to wrap this up.
I'm willing to continue this
Okay.
until we.
Any objection to this item being continued? All right, let's move on to the next item. Thank you for a good discussion. Reports from the SRO Collaborative. Juan Garcia sent his regrets he could not be here today. Mission SRO Collaborative. Raul is from the Families Collaborative.
Yeah, Raul Fernandez Carriosal with the SRO Families United Collaborative. For the record, just brief updates. Last week our organizers had a DPH training facilitated by Kevin Ann. It was really dynamic, and this week, on the 25th rather, they're gonna have the DBI training with Luis Barahona, so we really thank DBI for this. We're also on the finalizing all the planning for family leadership training that is gonna take place from May 16 to June 27. Coalition on Homelessness has a new organizer, and we're planning to have a celebration for all the organizers on May 10th. And also on May 9th, we're gonna conduct a Mother's Day action to honor the mothers that are searching for affordable housing.
All right, thank you. Clifford Gilmore.
Yes, Clifford Gilmore for the record. So just one brief update, and that is that Supervisor Matt Haney is calling on April 25th, calling for through the Neighborhood Services Committee a hearing on open air drug dealing in the Tin Line South of Market, mid-market area. And so from that, they're going to, hopefully if it goes through the committee, they'll be asked that the city agreed to establish a task force on open air drug dealing in that community. So we're going to be mobilizing a lot of our tenants who will actually show up and talk about the impact they're having, along with Safe Passage, who many of you know they have the service where they're providing safe passage to school-age children. And also, Safe Passage has some data on children who actually enter the drug trade. So it's not just people who are actually involved in the trade. There's some, according to Safe Passage, there's some injury to them as well as some injury to the community overall. So it's a very important issue, so that's what we'll be working on next week.
Thank you very much. Angela?
Angela here. At Chinatown CDC, we are trying to find a space to hold a forum on housing, so that people in the community could come and talk about their concerns. And this would be held because we want MOHCD and planning department and human services have a chance to hear from people. But we will need a room big enough for it, so we're still looking for a space. And then the other thing is Raul and the collaborative is looking at the training program for SRO families citywide. So we are going to start that training in May 7th, with last until June 27th for the duration, once a week. So we're going to start it first.
All right, thank you very much. Is there any discussion on any of these collaborative reports? Thank you. And this is a good time for us all to check in with each other on the latest stuff that's going on, so I appreciate everybody bringing these topics to us. Future meeting topics. Anybody have a future meeting topic? Yeah, Cliff?
Yeah, Cliff again with the record. So for the new members, some months back we revised our bylaws, and I do know that a couple of meetings previously, Jamie did into the body that in fact, so his expectations for how the body conducts itself. So one future topic I would like to suggest is that we talk about as a body, sort of code of conduct for the body, this body, and so I'd like to have a discussion around it. I don't think from my recollection that there's any language in the bylaws about code of conduct of members. I don't feel that it's been necessary in the past, but I do know when Jamie said what his expectations are, that I think we can have a discussion in the future about that.
Okay. There's the last meeting we talked about food security, and the person that was here last time. Yes. Anyway, I reached out to her, and she said that she can see if she can have something for our next meeting. We had talked about having it for this meeting, but I had trouble tracking her down because one of my staff is on vacation, so I couldn't get the contact information until Tuesday, a couple of days ago. So we didn't have it on this agenda. So she's going to be checking with her colleague about whether they'll be ready for next time, and it sounds like they might be, so we can have a food security presentation next time.
And also, of course, like I continued the resolution, which I will rewrite with some of the suggestions that people had, but I'm gonna try, I wanna like get it out soon, and I really, really wanna work in good faith with, people to get as much consensus as possible around this.
All right, thank you very much. We will continue at the next meeting. Other topic, yeah?
I think somebody also suggested last time to have a presentation by Adult Protective Services. Did I understand that right?
Yeah.
Have a note on that.
That was, yeah, okay.
You did, okay. So I'm just looking at my notes.
Does anybody have someone in mind that they could reach out to? that might-
Well, we have an in-house psychiatric social worker that I take with me and when I need APS assistance, and she can make the recommendation for APS. It's available for DPH and DBI use, but she's more than qualified to speak about
Okay.
when APS can assist a tenant.
And I can ask the director of APS to so that you guys get in contact with Achilles.
The director of APS.
Achilles SRO.
Thank you, Achilles Sawan.
He gives a good presentation.
Yeah, he's the manager of APS. And, maybe there could be something of both, because it's great that environmental health works with social workers and psychiatrists now.
Yes.
We are very happy about that.
I am too as well. It works a lot. It makes a big difference actually.
Yeah.
We could have both of them. Maybe.
Sure. Yep, I'll have to.
All right, anything else? Motion to adjourn?
I did mention like the anchor tenant thing, that could also be a future meeting topic, and most, to the code of conduct, most boards and commissions don't really have that much of a code of conduct, and it's basically like, just behave yourself, and you serve at the pleasure of the Board of Supervisors. So if someone misbehaves, the board will ask you to resign, or they'll initiate removal proceedings.
Okay, so I'm going to talk to Peter a little bit about that one before we calendar it. Yeah.
And just so I understood correctly, I think, was this the point in the agenda where you were asking for topics to discuss in the future?
Yeah.
Okay, so just quickly, I kind of wanted to shift the focus to the actual, like, bricks and mortar piece, the actual buildings. Many of them are old. And I'm just wondering, and I'm open to hear what other people are thinking, the need for like a physical needs assessment of the building, or a capital needs assessment. I think in a lot of the buildings, the pipes have outlived their lifespan. There's needs for electrical upgrades. So I want to know, how can we make that a requirement, that's performed? And who should be responsible for paying for it? And then
It's very expensive.
Yeah.
That's for sure. So we could definitely put that on as a future topic.
And
yeah.
if I may, I say this, just so, this is my first time being here, but I strongly believe in preserving SROs. It really is the only housing opportunity for individuals who are coming from a chronically homeless background. They have limited income. We need our SROs, but we also need them to be safe, and the environment needs to be healthy, and we need to just make sure that we're not just patching up things as we go along, but we're actually making them sound buildings. And maybe it's time to look at that. As expensive as it might be, it might just be time to look at the actual buildings themselves.
Sure, absolutely, I agree 100%. Sounds like we have a full agenda for the whole year laid out.
Well, I still have other things to add, but
Oh,
I'll
okay.
save those.
2 years.
Okay.
Is there a motion to adjourn?
Oh, wait, Jamie, you should note there's no public here to offer public comments.
Any public comment?
And you actually have to take public comment on every item. I'm like the Brown Act queen here.
Okay. There being none, is there a motion to adjourn?
Second.
Second, Margot. Okay, see you next time.
Thank you.
I'm waiting for him to call, but actually, I was just told, I mean, I knew this page would put out, I didn't know that it was the other stuff, which is great. Oh, sure, and she's supposed to call me, I think I just reached out to her.
So that was.
She, I might just,
Do I press?